Okay, Chapter 7. This is 7B, Designing Resistance Training Programs. I'm working on moving the camera around. Hopefully I look more at you than over to the side and stuff like that, so I'm trying. Okay, periodization. This is where we'll start. So, systematic variation in resistance training programs. The goals are to maximize gains, minimize overtraining, and optimize peak performance. So this concept can be used in other areas as well. It was developed for resistance training and being able to lift the most amount of weight for a competition, which was great. But we can use it in a lot of different areas as well. So we're manipulating training volume, intensity, the type of contractions that are being completed, and the training frequency. Within it, you have different cycles. You have macro cycles, 9 to 12 months, mesocycles. You could do that for 3 or 4 months, microcycles, 1 to 4 weeks. So it's a lot of different manipulations. They have the linear periodization, higher intensity, lower in volume as the cycle progresses. So as you continue through the program, you start lifting more weight and you do fewer repetitions. And again, the whole purpose was to maximize your strength for a strength and conditioning competition, so an Olympic weightlifting type of situation. Reverse linear, lower intensity and higher volume as the cycle progresses. So depending on if you're trying to do more endurance type stuff, that would be appropriate. Undulating, short microcycles with frequent changes in intensity and volume. I like to kind of put this more, and that's why I have my name in the corner, more into practical levels. So everybody could use periodization. You know, for the most part, we think about it it's talked about in the powerlifting arena. But really, when you look at it, you can think of it as the preseason, basic conditioning, trying to get somebody ready for pre-preseason, excuse me. So that would be basic conditioning. But then you have the preseason where everything's ramped up to try to get ready for the season. So this is where a lot of the training and the higher intensity stuff is done. This is where people have the more muscle soreness and things like that. You have the in-season. You're trying to maintain your fitness. You're trying to decrease your risk of injury. You're not necessarily doing things to increase the levels of strength you have as much as trying to make sure you don't lose what you have. And then you have the immediate postseason where you're just trying to rest, recover, get away from the sport a little bit, maybe get away from training a little bit, do mild types of activity, and then you go right back into the preseason where you're trying to get yourself at a basic level of fitness and kind of working through these different cycles. So you could do this. This is a good example for sport. If you're dealing with it in other situations, you adjust things accordingly. You see it a lot with running, where they'll taper the individuals for running to get ready for a competition and things like that. So I list I'll just core stability training. We'll keep with that. So a big thing with core stability training: maintain ideal alignment of neck, spine, scapula, and pelvis. Have good posture. To improve core stability, you can complete resistance exercise on unstable surfaces, develop muscular endurance more than strength and power. And for core stability training, a big thing there is the plank. It's holding a position. When we're standing or doing a lot of aspects of activity, there's certain parts of our body that are really completing an isometric contraction. And the muscles associated with what we typically consider our core, our abdomen, our hips to a certain degree, and our low back, those are all relatively stable. They're not necessarily making huge movements, but they're trying to maintain your core posture. And for those types of exercise, the plank or stuff that develops muscular endurance is more important than necessarily developing a whole lot of power or strength. Functional training, body weight training, that's great for improving muscle, joint stability, flexibility training to perform daily activities more efficiently. Exercises of functional training, spinal stabilization, proprioception, and balance. Proprioception is where you where you are in space, being able to kind of feel where you are in space so that you can move properly. It's a lot of lateral types of movement, things like that. Then resistance and flexibility. It's mainly the body weight calisthenics is the functional training. So I break down into a whole bunch of different modalities of training. So there's a lot of things here. I try to go into some kind of strengths and weaknesses and explain what it is to a certain degree. So with circuit training, it's more muscular endurance. You can have 10 to 15 stations. You can repeat it a couple times. You have 30-second rest between stations. 15 to 20-second rest. I don't know why I got both, but we'll just say 15 to 30 seconds or 30 seconds at a station and 15 to 20 seconds rest between stations. Figure it out. So when you're doing that, and there's a lot of different ways of doing that. The curves was a way that they did circuit training for a while that was designed and geared towards women. I didn't like the way curves was designed. I thought it could be designed a lot better. The basic idea was good, but then the way they implemented it, often they used equipment that had hydraulic aspects to it, so it was all concentric. Eccentric exercise is a very important part of injury prevention and muscle development, developing strength. We don't move just concentrically. We move concentrically, eccentrically. Concentric is the contraction. The eccentric is the more the elongation of the muscle, and the eccentric aspect is what we use when we land or absorb a shock or absorb things. Very important, especially from the perspective of injury prevention. And that's what I had an issue with curves. But when you look at the basic ideas of circuit training is fine. You'll see different varieties of circuit training, like at the Y, at least they used to have. They used to have a station where you did resistance exercise, and they did that. And then you had a station where you did aerobic exercise, and they kind of went back and forth between a little bit of aerobic exercise, then a strength, then aerobic, and they'd have a timer on the wall. All that is fine. It might be something you like, it might be something you don't like, but if that's the way people want to do things, that's fine. You have isokinetic training. Isokinetic training is hydraulic types of systems. So that's what they were doing at the curves. You have fancy machines. Basically, you're controlling the speed of the movement. So no matter how hard you try, the speed of the movement stays the same. They use this in athletic training, somewhat in PT. They use it for certain aspects of strength training in athletic training. I don't personally like it because that's not the way we move. That's not the way we exercise. So it may be advantageous in one setting, but from a practical perspective, we don't have access to this equipment. It's expensive, thus we don't have access to it, and it's not something really available. So, and again, it takes away from the eccentric aspect of the movement, which is a very important aspect. So everything you do ends up being concentric. You push the weight out. You're doing that at a certain speed, and then when you're done, you're pulling the weight back in. You're using agonist, antagonist muscles. So, but the advantage, increased strength, power, and endurance. As with any form of resistance exercise, you're controlling the speed, minimal muscle soreness because there's no eccentric contraction. Disadvantage, costly. And there's no hypertrophy, there's no muscle soreness, so there's no hypertrophy. Traditional weight training advantages incorporates the core, especially dumbbell exercises. You have to control that weight. Greater levels of strength can be achieved. So for now, for me, I'm mainly doing body weight type exercises now. But really, if I want to get stronger, especially with certain movements, it helps to do the weight training. You get more bang for your buck. You get changes and adjustments quicker if you do the weight training. So there's definitely an advantage there. Disadvantage, you have an increased risk for poor form, which thus leads to increased risk for orthopedic injury. increased risk of lifting a weight that you can't handle, so you need to have a spotter. You can get hurt. I don't know if y'all have experienced it, but I remember lifting weights, doing a bench press in the basement of my home when I was in high school, and I couldn't lift the weight, so I was trying to get it off my head. It was scary. It wasn't a hugely large bit of weight, but you definitely run the risk of getting yourself into trouble because you're lifting a weight that you can't handle. So after that, I learned, and I made sure I always had a spotter when I was trying to do weights that were kind of iffy. But you definitely run that risk. Prepping the exercises like dumbbells off a rack can increase injury risk. I personally believe that a fair amount of my back issues, one was related to poor form with weight training, doing that pelvic thrust when you're doing the bicep curls and the other exercises, as well as just taking the weights on and off the rack. When you lift the weights off the rack, you're not necessarily thinking of proper form, as well as you have to extend your arm. It's creating a long lever arm, which is not particularly good for your back. You're doing it a fair number of times. So I think just the exercise of lifting the weights on and off, lifting the weight plates off the ground and things like that, I think that can also increase your risk of injury. There's no data really to support that, but I think I think that is an issue out there. Power training advantages: develops the ability to complete movement quickly. You engage the whole body in many of the different types of movements, and as was mentioned previously, you could do this with body weight. And when you do this, typically they recommend that you use relatively a weight that you can handle, a moderate weight, a lower weight. Disadvantage: you have to have a high degree of skill and flexibility, being able to initiate a contraction and being able to get your muscles to fire in the proper order, which is not necessarily obvious. A higher risk of injury, especially if it's completed incorrectly. And when I was talking to you guys, the students, and those of you that played football or played sport in high school and you had to do any sort of power training, you didn't necessarily have a good coach. Other instances, you did have good coaches and you learned how to do the exercises properly, and that's great. But a lot of times, you're just kind of thrown to the wolves. You try to figure it out as you go, and as you do that, you're more likely to make mistakes. And it's dangerous. I'm sure if you look on YouTube, you can find epic fails. I remember looking at those types of videos, and they were kind of scary, and you just wonder how hurt those individuals are that are in those videos. Weight machines. I'm not a fan of weight machines, but they are safe. They do isolate muscles. There's instances where that is something you might want to do, especially in a rehab type setting. That might be something that's useful. Disadvantages: you do not move freely or normally, and the core is inactivated or it's not activated in many instances. So you're not really engaging the core, or you're not engaging the core nearly as much as you would, because it's in a fixed plane than you would be if you're using some sort of free weight or just moving freely. Now, the main weight machines, I'll also mention that you have different types of weight machines. So you can have a Pilates bench. That's going to, I guess you could consider it to be a weight machine. You could have a cable crossover. That's a weight machine, but your arms and your body move a little bit more freely. That's going to be better than some of the other weight machines where you're moving in a fixed plane. So this is where I put the free motion cable crossovers, those machines that have arms that come out with a handle. You could do many different types of exercise, increase freedom of movement, so those are good. Disadvantages: uses, movement patterns that can be completed of the machine are not obvious. So I remember going up to one of these machines and not really having used it before, and I just kind of went up to it and I'm like, what the heck do I do with this? And I'd imagine that if I felt like that, then a lot of people that are less experienced than I am go up to a machine like that and are kind of like, okay, what exactly do I do with this? So I think that's a disadvantage, and the subject may perform incorrect or ineffective exercises. So based on not really knowing what to do with it, you just start pulling on the levers and pulling on the handles, and you might not really be doing anything that's helpful. So learning how to use the machines and how to do things correctly, I think, are going to be useful. Bands, the exercise bands, the rubber bands, you see them a lot in physical therapy settings. They're lightweight, they're portable, they're cheap. They're good for small specific movements, so they're good from a rehab perspective. Disadvantage is you can't create large amounts of resistance with a band in most instances. And it's not particularly good for completing complex movements. So it's got its place, particularly in the rehab, or if you're traveling, you can throw a bunch of bands in your suitcase. It's fairly easy, as opposed to trying to bring a whole lot of weight with you. Kettlebells are great, but you can easily get hurt with them. So advantages: easy to hold. Most exercises engage the core to a high degree. If you look at the poster in the arc on the individual completing the kettlebells, if you really look at it, you see that individual is completing the kettlebells with good form. But if you try to do some of those exercises, you might not have the flexibility, you might not have the core strength to do those types of exercises, in which case, or the neuromotor aspect, which is you just don't know how to perform them properly. So your back is hunched over as you're completing the movement. If you're doing things like that, you increase your risk of injury. So often completed with poor form. Many exercises create momentum, which increase the risk of injury when not completed correctly, and that's a big issue. So for a lot of people, you cringe when they use the kettlebells. It's a good exercise. It's a good tool, but if you're not doing it right, it will likely do more harm than good. Many exercises require a high degree of skill and core stability. CrossFit. So CrossFit's pretty popular. It's you do a lot of different types of resistance exercises. The advantages of it: you have camaraderie, you have competition. People perform harder and thus push themselves, and you push each other. Those are good. It has a high degree of variability, so they're changing the workouts, so you're not doing the same thing over and over and over again. So that variability is generally recommended. Incorporates different resistance exercise modalities, so you're mixing and matching with a lot of different strength exercises, power exercises, body weight type exercises like pull-ups. So you're doing a lot of different types of things when you're doing a CrossFit workout. So all those things are good. The bad. The disadvantages: every day is a competition, and what you see is that form falls apart when you're competing. And when you compete every day, then your form is likely falling apart every time you perform the activity. So with standard power training, they're trying to have moderate weight, you're not going to fatigue, and the whole purpose of that is then you're able to do that movement with good form, and you can do it with good form. Do it properly, and thus it's more effective, decreases the risk of injury. But with CrossFit, a lot of times people go to fatigue, people go to exhaustion, so they push it another rep. And when you watch the CrossFit games, oftentimes the first couple of reps they do with a certain exercise, great form. And after that, the form is a disaster because they're just trying to lift the weight any way they can. And with that, you increase your risk of injury. And that's really my concern with CrossFit. Different CrossFit gyms or boxes that they call themselves, they're going to have different people there, different people running them. Some people are going to be really watching form a lot. Other people, not so much. So it's going to be highly variable from one facility to another. Issues of potential overtraining. You hear about rhabdomyolysis, which is muscle breakdown. If your muscle breaks down too much, then that is going to be detrimental to the kidney and it can kill you. If your urine is a coffee color, So brown or black or any color other than yellow or a colorless color, clear, colorless, that's a problem. So regardless, you should go to your doctor. It might be a kidney infection, it might be a bladder infection, whatever. You should get that checked out by your physician. But with CrossFit, you could have this rhabdomyolysis, which is a muscle breakdown, and it can get to the level where it can cause kidney damage, kidney failure, and can be quite serious. So the potential of overtraining is much, much greater with CrossFit than it is with other forms of exercise. Yeah, and then I mentioned the rhabdomyolysis. There's also a ton of other different modes. I don't even mention the TRX bands, that are out there. There's also like ninja training, obstacle course training. There's a lot of different things out there. I put a couple other things, gymnastics, the old school gymnastics. It's great exercise. Dance, a lot of the girls are involved in dance types activity. Again, a great exercise. And you could go into advantages and disadvantages with every type of exercise. Like for instance, ballet, great working on your core. It's good for, actually it works on your, I can't think of the word, not internal obliques. I can't think of it. Anyway, I'll think about it later. But it's not engaging a lot of the core. It's, oh man, now I feel like an idiot for not remembering. You have cheerleading with partner stunts. That's almost like a lot of powerlifting that you got going on. And that's a great exercise. The girls have to really engage their core by staying stiff so that they can hold the position, and the guys have to engage their core to make sure that to hold the girl in place. So acro yoga is it's almost like cheerleading partner stunts. It's very similar to that in a lot of ways. Pilates, parkour, lots of different things you can do. The key with this is, and I've mentioned this before, is that then you have to take these activities and figure out how is this counting. So a lot of times when that's probably my next slide. Yeah. So it's a matter of multiple modes being employed. No one mode is superior to another. Plus, all modes carry a kind of inherent advantages and disadvantages. Nothing is perfect. You can overlap modes of resistance exercise, functional training with weight training, and that's really what we recommend. So if somebody's doing resistance exercise, and let's say they're doing pull-ups, well, what the heck does pull-ups count as? It's not, you can't do a 1 rep max on pull-ups, but you could say, okay, this is a strength exercise, it's a muscular endurance exercise. You shouldn't kip while you do that, that's bad for your back. But you do you do pull-ups, okay, you can't, a lot of people cannot do 10 reps. I could do 10 reps, but a lot of people can. A lot of girls can't even do 1 rep, so you have to adjust it. But if you could do 10 reps, 8 to 10 reps, whatever, then that counts as a resistance exercise. Okay, it's not, you don't have a 1 rep max range, but you figure out, okay, what muscles are involved with it, and you count it into the whole system. It might not be a perfect place to place pull-ups, and if you're trying to check a box, how does this fit? It's difficult to do, but just intuitively you say, okay, this fits, this works, it'll count as a set. You get your biceps and back and your probably, a lot of your back, shoulders, core stabilizers, they're all involved in doing a pull-up and kind of work your program around that. So oftentimes with resistance exercise, it's encouraged that you mix and match. Do some strength, do some power, do some hypertrophy. There's going to be inherent overlap with that, as well as body weight type exercises and more balance and flexibility type exercises as well. So the steps in designing a resistance training program: identify your goals. Is it toning? Is it strength? Determine your your program type, dynamic, isokinetic, identify muscle weaknesses from assessment. We'll talk about the functional movement screen after this exam. That's a great way to figure out where you potentially have strengths and weaknesses. And then select the exercises that you want to complete. And this is really your job as a trainer, as an exercise physiologist, is the individual. You need to teach the individual to a certain extent, but the individual just wants to be told what to do. So they want to learn through osmosis. They just want to learn through doing. You're learning through academic and learning different ways of doing things. You could develop programs for different types of people, but for the individual, they just want to know, how do I develop a program for myself? That's all they care about for the most part. So that's what you're doing. You create a program for them, and they learn through doing that program. And then hopefully they should be able to do the program on their own. And if you develop a program and teach them how to do it, they should kind of say, okay, I could do kind of this list of exercises. That'll count. If I do this program, it'll be a good holistic type of program. And that's your job, is to teach them and create that for the individual based on their goals and the other things you're trying to accomplish. So basic things: order of exercise, goals, guidelines for progressive overload. So how do you plan for this to progress? And just watching the individual and say, okay, it looks like they're doing this exercise well, so we're going to progress them. It looks like they're having problems with this exercise, especially if it's a balance issue, then let's remediate. Let's do something that's a little bit easier, get them stronger, try to work on a weakness, get that stronger, and then hopefully that will help them to be able to perform the exercise movement better. Whatever the case may be, but you're trying to set those guidelines. And as with aerobic exercise, progression is critical. So even if you start easy and go slow, what was in one of the other PowerPoints, that's fine. But you want to make sure that people are improving and that they're improving basically. It may be that they don't reach high levels of fitness. It may be that they don't get to the advanced or elite level associated with strength training. But what you want is that they are improving and they're kind of maximizing their own potential to a certain degree. So, to do that, you need progressive overload. Some different populations, children. A lot of the issues with children is just movement exploration. That's really depends on the age of the child. I'd say when the child is hitting puberty, maybe 11, 12, that's when more of a traditional strength training and learning resistance movements is probably more appropriate. But up until that point, doing things on a jungle gym, push-ups, jump rope, just playing, those types of activities are great. If you're doing rock climbing, that's good. If you're or just climbing trees or climbing rocks outside, or if you're climbing in a rock climbing gym, great. But you're just kind of learning your body, learning how to do different things, trying to get a little bit stronger. Those types of things are what should be encouraged. Gymnastics, dance for the girls. Gymnastics and dance would be great for the guys too, but you see less of that. So any of those things, that's what really should be encouraged. Doing hardcore resistance exercise isn't really necessary, and from a psychomotor perspective, the kids just they don't get it. They don't get how to complete a complex movement, and as much as you try to teach them, they probably still wouldn't get it, and they don't have the patience for it. It'll be an exercise in frustration. I've got 2 kids. Matthew's 11, Gabrielle's 7, almost 8, and I wouldn't be able to teach them these types of activities. But they're active, they move, they played sports, dance, whatever, So they're getting there. But really, to learn the traditional forms of exercise, it helps to be a little bit older, and I'd put that age at least 10, depending on the maturity of the child, but probably 10, 12, 13, that's probably 10, 11, 12, 13. That's probably about the age when you start these things. And with the children, once they start to get better at the activity and they master activity, that's when you move on. And that's going to vary from one child to the next. You see some kids that are just a klutz, and other children that are pretty good with their movement. So you definitely take that into consideration with how much you progress. Emphasize correct technique, 2 to 3 days a week, close supervision and monitoring. This is when you learn bad habits, and you probably learned bad habits in high school when you started resistance training. This is the time when you really want the individuals, and especially at the younger ages, just learn how to do it right. And if you learn how to do it right, you'll continue to do it right. But if you start doing it on your own, chances are that you're going to move improperly because you just don't know any better. And then you're probably going to be fine, and you're going to be fine as a child and as an adolescent for the most part, as a teenager. But then you could run into problems later on. Yeah, that's good enough for that. And then for the older adults, just refer back to the positions.